I work in a local trust here in North East London for the Clinical Health Psychology Department. And we receive many referrals from the specialist endometriosis team that works in that hospital. And as such, I've got quite a lot of experience in working with women with endometriosis. Typically, these women have stage 4 endometriosis, so pretty severe. But much of my experience in what I'm going to talk about tonight is based on my work with these women. Yes, and I'm quite passionate about trying to get the psychological impact message out there, because I think currently there's still not enough done to provide psychological services for women like yourself. So I hope that explains what I do.
That's great. No, that's really helpful. No, that's great to know we've got you on board and in the background and things. So, yeah, let's just roll right into questions, because there are a lot, and some of them are quite straightforward to answer, other are more complicated, and we appreciate that the questions that are coming our way might be addressed more to some people than others. And so please bear with, because there are different opportunities, if you like, for support. There are different ways that people get intervention and support. So I think, you know, we need to just keep a breadth of, you know, understanding of where the answers are coming from, as well as what can be expected in your particular area, because it might be different. There are some question and answers that are coming in, so I'll not ignore you, but I will reply to some of them as we go. So Margreet, the first question we have here is, if you're ready, is what obstacles do you think there are with primary care support in offering early intervention or signposting those to be offered group or individual long-term therapy? So that, I'll repeat that again. Obstacles you think that there are with primary care support in offering early intervention or signposting to be offered group or individual long-term therapy.
Yes, well, I think I have to be quite pessimistic here, actually. Early intervention is actually very difficult in relation to endometriosis because the diagnosis often happens so late in the day. So if that changes, and for example, a GP is able to diagnose it or has awareness and can signpost very early on, I think that can change. But for now, I think I can quite categorically say, as far as I know, there is no early intervention possible. I'm also not aware of any endometriosis specific group work, although there are pelvic pain groups, which I think are typically based in hospitals. And they will address some of the pain symptoms in endometriosis and possibly allow you to share your other experiences as well. But as far as I know, there's nothing specific in terms of psychological support, apart from support groups that Endometriosis UK runs, of course. So, and that has perhaps an element of looking after your psychological health. Individual long-term therapy, you know, I think it's really important for you when you are being seen by a consultant and your endometriosis is addressed, that you explain to them that you would like psychological support. So be assertive, because very often it will not be thought about or it will not be offered to you. So I would make it very clear at the very earliest possibility or opportunity to ask for psychological support. You know, there are, however, long waiting lists for almost any NHS mental health service at the moment. And sort of non-specific endometriosis services such as IAPT, which is the talking therapy service. This is one where you will be seen a bit sooner. There's a shorter waiting list, but it isn't a specialist service. But it could help you with some of the symptoms or emotional distress you're feeling in relation to endometriosis. But that's really the best advice I can give you, because yeah, early intervention just doesn't exist, unfortunately.
Thank you. Thank you. Next question. It is very hard to, you know, when you feel like you're living in the real world with waiting lists, that in itself has an impact. on
Yeah.
all of our mental health and
Yeah.
wherever we're coming from.
Yeah.
The next question is, so there are mostly articles on dealing with sadness or depression from endometriosis, but not any on anger. Are there any resources, methods, techniques to manage anger that you're aware of, or any support for that you've provided yourself for other people? And could you just address the issue of anger rather than just depression?
Yeah, it's a really good question, actually. And I'm really happy to go into detail a little bit about this one, because I think anger really has a bad reputation most of the time. And actually, it can be a really useful tool for understanding what's going on beneath the surface. So seeing it as a tip of the iceberg emotion, really. So when we learn to dig deeper into where the anger is coming from, recognizing when the anger is rooted perhaps in sadness or shame or a number of other different emotions, it can really allow you to process those emotions and work through them in a kind of healthy way. And research actually has led to an understanding of anger as often a masking or cover for deeper emotions. So this can be any range or combination of emotions, including grief, jealousy, loneliness, fear, anxiety, exhaustion, pain, embarrassment, and it goes on, basically any emotion, I think. So anger should never be suppressed, in my opinion, because it is a valid and necessary emotion for understanding what's going on inside of us. And further, that understanding of anger empowers you to have constructive and healing conversations around your pain. Sometimes the emotions causing your anger is not always clear, which is just one part of the inner work that, for example, psychological support could help you with. And I'm going to discuss what exactly you can do to help identify anger. So, for example, in coping and managing endometriosis, the powerlessness, for example, of managing the pain can make you, for example, lash out at yourself by blaming yourself for not being stronger or more assertive, or whatever else you feel is lacking in the way you handle it. And this can, of course, lead to feelings of anger. And that anger is often protecting you from a deeper, more vulnerable emotion, which is often involved in, for example, shame or loss. And those are more challenging to express. So, like in any other emotion, the feeling of anger is actually communicating something about us. So it makes us aware that we need to look further into why we are feeling angry and what other emotions have led to the anger we are currently experiencing. So it's really important to understand one's own anger and understanding anger that's directed towards you. So from another, because that can happen as well. And I know some of you experience perhaps conflicts in relationships, etc. And, endometriosis can be challenging within a relationship. So often anger can be expressed within that context as well. So there is a way of trying to manage and understand anger. And so it's basically 4 steps. So the first thing is to try and understand what triggers this anger in you. So you can ask yourself, where is this emotion coming from? And to do this, it recommends you paying attention to the things such as thoughts, feelings, experiences, etc., that led to this anger. And this will also help you to identify specific triggers in the future. So just look at your anger as a communication. What is it trying to tell you? Because after all, it's here for a reason. And I think that's really important to remember. So secondly, just identify what's going on underneath this tip of the iceberg. So once you've identified the trigger, you can get to the root of the deeper emotion and prioritize that over your anger. So if it is shame, for example, you may have to look at past experiences or limiting beliefs you have about yourself. If it's jealousy, maybe you need to work through some feelings of insecurity. But ultimately, it's about unpacking your anger to understand yourself with more clarity. Now, number 3 is to help yourself feel calmer. So within all this work, there is a need to self-soothe and emotionally regulate. So, of course, as mentioned, anger is valid, but we don't want it to become destructive. So if you feel anger rising in you, take a walk, focus on some deep breaths, and relax so that the tension in your body is reducing. And maybe also take some time, because if you are still feeling like you need something more in order to work through your feelings in that moment, perhaps do something like gardening or some exercise, because that can also release some of that pent-up tension in the body. So finally, you need to channel the energy that anger gives you, because anger is typically an energizing emotion. So when your emotions are overwhelming and confusing, it can be difficult to focus on anything else. So understanding them will help you to channel that energy into things you'd rather focus on, whether that's making a societal impact and contributing to a cause, or changing something in your personal life that you are unhappy with. So anger is a natural and essential emotion that is bound to come up in one way or another. And I think in my work with women with endometriosis, very often I hear women say, well, we were raised to not express anger. It's a bad thing. You know, if you're a good girl, you don't express anger. And that in itself can make you feel weak. You know, it can make you feel ashamed. And so expressing anger is really important. So of course, I don't know the person who asked this question, you know, what exactly their circumstances are, but I hope that this is helpful, that gives you some idea what you can do with anger and how it expresses itself.
And it's really interesting, because there's a couple of questions about relationships and the impact on relationships, and anger can be one of those ways that we demonstrate our frustration at ourselves, yes, or our situation in relationships, yes, and that's, you know, that's not to be ignored, and things can be addressed. Yeah.
Well, you're right, actually, because even depression can cause irritability, yeah, which is often expressed in anger, you know, being short-fused, yeah, irritable, you know, so, and tiredness, of course, as well. So yeah, it feeds into many different layers of emotional experiences, I suppose.
Yes, yeah. I think with each of these questions, we could go on and go a bit deeper with each of them. So it's frustrating for us to not have more time, but we're to try get through the questions. Let's get on to another. Sure. This one's a cheeky one because it's got 2 parts to it. It's a cheeky question with question A and question B. The first question is, in your experience, have you observed any improvement in patients' mental health after surgery to remove their endometriosis scarring? And then what percentage of patients, the second half would be, then what percentage of patients would you say experience an improvement, and how soon should that be expected if you have seen it? So, yeah.
Yes. So, I mean, surgery is usually helpful in reducing pain. So, because often women have surgery to reduce pain primarily, but of course there's, you know, taking away the endometrial tissue and etc., but it reduces pain. Now, having chronic pain can cause feelings of depression, anxiety, worry, and hopelessness. So you can imagine that when there's a reduction in pain, it will have a positive impact on your mood and well-being. And when the pain is more manageable, you will feel more optimistic about the future. And so, yes, it tends to improve women's mental health. So pain has a big effect on so many, you know, domains in our lives, really. So, and surgery, because it reduces pain, it will by definition make your mental well-being, or will it improve it? Even if the pain hasn't gone away completely, because for many women it doesn't, it will be much reduced, and that in itself will help you feel better.
And have you any idea about timelines when people should expect that, or? Is it just as
Well,
it unravels? What do you
that
think?
is such a difficult question because, you know, I have had, well, I think most of the women I work with have had surgery whilst I was seeing them.
Yeah.
And it is different for all of them. And for some of them, they continue to have pain. You know, so it's such a, again, it's such an individual question, really. And to be honest, I wish I knew what to expect. You know, what is sort of an average. And I think I heard someone say it's about 12 weeks that you should definitely feel better, but I could be wrong there, maybe 8, but it's definitely a bit of time, you know, because the scar tissue, you know, all of it needs healing. Yeah, so I think it's better to ask that question to the people who operate on you. Actually, they might be able to tell you with more preciseness than I can.
Yeah. I think to expect a period of time for general recovery anyway, because any operation that you would have that.
Yeah, I think any abdominal surgery takes at least 6 weeks.
It's a big deal. Yeah. Don't underplay that at all. Okay, on to the next question. Alongside therapy for endometriosis management, is there mental health support for fertility issues? And if there is, can that be delivered together? Or if you've experienced relationship issues that are no, hang on. I think this is a separate question actually. So if there is, can they be delivered together? That's the question.
Well, many in hospitals they call this subfertility. So as a medical science, it's subfertility. You know, that's the department where you will be seen if you have fertility or challenges in fertility. So many of these services will offer mental health support. And in fact, the NICE guidelines actually state that every couple or woman that is experiencing subfertility should be offered counselling. So many hospital departments will be able to signpost you or have services in-house that they can refer you to. In terms of whether they can be delivered together, I'm sure they can if you, you know, I think, again, it's person specific because some of the counselors or mental health practitioners you see there may not be able to treat both. They may just not know enough about endometriosis, but others you might find can, because they may have seen many women with endometriosis and subfertility. So it all depends on the experience and specialism of the person you're going to see. So yes, I'm sure it's possible, but I don't know currently if there are actually services that do this. I'd be surprised if there were, but who knows?
Yeah. Okay. And an aside to that question, another one that was slid in as a sub question was really to do with relationships. And there are a few questions that have come up on the Q&A about the impact on relationships. And I think it might be good to introduce that as a kind of subtopic, really, and things, you know, both from the point of view of, you know, if you're single because of your endometriosis, or if you're in a relationship and you struggle, you know, emotionally or physically, or your libido is low, or, you know, that there's kind of, you know, is there therapy there that could help explore some of these things? What sort of things would you recommend for people in their relationship? You know, struggles, really. Have you got any ideas or tips on that one? Top tips from Margreet.
Well, I mean, first of all, I think just having psychological support will help you, because you can, you know, typically psychological support is a safe place to bring up anything that is currently occurring in your life and that you have trouble managing or find upsetting or distressing. So something like problems in a relationship can certainly be discussed in any type of therapy. I think with anything sort of chronic conditions concerned, such as endometriosis, which can affect sexual pleasure, you know, the ability to function, you know, on a normal daily basis, you know, those can be stresses for a relationship. And, you know, the kind of therapy that I tend to offer does have psychosexual health as part of the therapy. So we do talk about that element of suffering within an endometriosis presentation. I think in many relationships, communication are often an issue. And I think one of those is being assertive, looking after your own needs, communicating in a clear manner. For example, not assuming that the other person will understand, you know, the pain you're in, or the fact that you have trouble doing something or having to let them down because that day you just don't feel well enough. It is so, so important to be clear about that and communicate that in a clear manner, because I think a lot of relationship issues stem from the lack of good communication and being sort of thinking, oh, they'll understand, you know, the assumptions. There's always a lot of assumptions. So that always needs to be looked at. And that, again, can also be practiced in therapy. You know, we can model it in therapy, for example. So those are just some ideas of looking at your own communication style within your relationship. And, you know, psychosexual health is important. And again, even in, you know, in sexual activity, being clear, you know, communicating clearly what is hurting, what is nice, what, you know, what way of having sex helps you or doesn't help you. All these things you need to be clear about, and it's very difficult to do that. I know that, but that will all help you. So yeah, that's more or less all I can say just offhand about that. But in therapy, and if you would have someone who works like me, you could certainly address these issues. I hope that helps a little bit.
Yeah, no, that's very helpful. I think because some of the questions that are coming up on the QA are related to that, then there may be more information people want, and that's great. They can come back to us and we can seek to address that further. But that's really good to get that overview. Thank you. So
yeah, can I just add, actually, it just comes to my mind. Also, maybe in terms of, you know, sexual intimacy, it might be helpful not to be sort of, sounds maybe a bit silly, but to not be goal driven in terms of your sexual activity. So, for example, you know, only sex that results in orgasm is successful, for example. It doesn't need to be that way. You know, you can be intimate in other ways, and that can be pleasurable. So also sort of changing the way you view having sex and talking about that is really helpful, because I know penetration is often very painful. So if it hurts, then maybe approach it in a different way, or don't do it at all. Just do other things, you know. So it's really important to remember that as well, because some of this is very society driven, you know, or we ought to do it this way, or we should be doing this, you know, and changing that will really help, as long as you communicate this clearly and your partner is on board with this. You know, it will all help.
Yes, you're right. And I think communication is the key in all of that, isn't it? And sometimes you've got to be very brave to be starting that conversation, and you know that is difficult when sometimes you don't have the words to put to it. So learning a vocabulary that you're personally comfortable with is part of that process.
Yes, and it's even harder for single ladies.
Yes,
we're talking about relationships now, but for women who are not in a relationship, in some ways it's even harder, because how do you, you know, when you're dating someone, how do you approach that subject, you know, in a way that, you know, feels safe and you know, feels okay? It's very difficult. So it's difficult whether you are in a relationship or out or not in a relationship.
Yeah, that's great. Thank you very much. Now then, on to another topic. Other than general CBT, that's cognitive behavioral therapy, for those that don't know what the CBT stands for, what other types of therapy can help manage endometriosis or chronic pain or illness? Are there other types of therapies that are recommended apart from CBT?
Yeah, and again, I wish I knew the person who was asking this question. I wonder why. So I just want to start by saying that CBT does have a place. I know that it tends to be the buzzword, so to speak, by GPs and the medical profession. You know, CBT, you know, we'll refer you to CBT. There is much more under the sun than CBT. So I don't know if this is what this person who's asked the question was inquiring about. It is, however, helpful, especially if you suffer of anxiety or depression, you know, mood disorders, because they tend to be maintained by our thoughts. So CBT will typically promote an awareness of the impact your thoughts can have on your emotions and how these together have an impact on your behavior in response to those emotions and thoughts. So it will teach you to modify your thoughts, making them more helpful, perhaps more realistic, or your behavior, which in turn then improve your emotions. So the behavioral component of CBT is especially helpful, as many of you, and I really want to highlight this here tonight as well, because many of the women I work with engage in that boom-bust cycle that causes further strain on the body and also affects you psychologically. So the boom, just to explain, happens when you overdo it on days that you feel well, which then results in a bust the following day or few days as you've done too much. So your body is then fatigued and in pain. And this can be psychologically very difficult to cope with, as it reinforces the belief that you are weak or there's something wrong with you. It can cause self-blame, etc. So pacing yourself by listening to your body's cues and tune into these at an early stage, so not when you are already in pain, because at that time it's too late. So you might want to take a cup of tea. For example, you're hoovering and you start to feel the first signs of a bit of strain. Stop then. Don't stop when you are already tired and fatigued and in pain. Stop when you can do a lot more. Have a cup of tea and then continue. Because there's research once more that shows you that if you pace yourself, you get actually much more done than if you're not. So you're much more productive and you will feel psychologically much happier if you can just pace yourself and do everything you want to do. So I think there is, what was the question again? Can CBT help?
Anything other than CBT?
CBT therapy, yeah. So, I mean, endometriosis does have, in my experience, a really big psychological impact, you know, which can cause many difficult emotions and distress. So in my view, the best therapy for endometriosis is a mix of pain management. So you can access that, for example, in pelvic pain groups, maybe in the hospital that you're attending, or in a specialist pain management service. They exist as well. Practicing mindfulness. CBT is a part of that. EMDR, which is a trauma-based and focused therapy, and I will explain that later. Compassion-focused therapy, because many of you are so hard on yourself. So being a bit more compassionate and kind to yourself would really help. And psychosexual health, as I mentioned earlier. And all of that will be integrative. So all of these will, you know, one will overlap the other and will work in an explorative style to look at your individual circumstances. So that mix is really helpful. But accessing these at different times, if you can't find someone who works in this way, will also really help. But each woman is different. You all come with different expressions, different experiences. But in my view, this mix works very well. So I hope that kind of explains it a little bit.
Mm-hmm. Yep, no, that's good. Are you going to explore EMDR later on, did you say? Or do you
Well,
want
I
to
can
do it
say a
now?
little bit about it. So EMDR is eye movement desensitization reprocessing. I always struggle with that title. So it's a type of therapy that is particularly focused on trauma. Not necessarily only that, though. It also has protocols for pain. It has protocols for depression. It has all kinds of different applications. But in endometriosis, about 40, I think it's 48.9% of you, which was research done a few years ago, actually has suffered trauma. So that's nearly half of you. So addressing that trauma is really important. And EMDR helps you to do that by, typically, if you're in the room with someone, by following someone's fingers, which then bilaterally stimulates your brain, which helps to consolidate memories that are at the moment fragmented, stored in different parts of the brain, which can cause you to feel stuck and in a kind of fight or flight mode a lot of the time, which is what, not good for the body, because it can have sort of the response by the body could be inflammatory. So it can cause inflammation. So it's actually really, really important to address the trauma, because trauma also makes you more sensitive to pain. So it's all, you can see how it all comes together, really. So EMDR is really amazing, and it has amazing results. And often I see a reduction in pain, when we do it successfully. So, yeah.
And because it's often associated with more PTSD type symptoms, I think people shy away a little from it rather than the usefulness of it, a therapeutic medium.
Yeah.
To kind of address things. Yeah.
Yeah, I think it's trauma. It's everywhere at the moment. It has and rightfully so. There's a big focus on trauma-informed care generally, and I would say that probably most of us have had some trauma in our lives, because it's not so much what's done to us, it's what happens within us. Mm-hmm. So it could even be when you were, I don't know, even the experience of going to your GP at 13 years old with severe pain, because of period pain. You go to the GP and you're saying, I have so much pain. And the GP turns around and says, there's nothing wrong with you. It's just a heavy period. Off you go. Or you get the contraceptive pill or whatever. That can be traumatic, that in itself, because you feel dismissed. It can cause all kinds of, self-doubt. It can cause you to blame yourself because, well, look around me, all the girls at school, they're all seem to be fine. They have periods, but they don't take time off. Whereas when I get my period, I have to lie in bed for days on end because it's so painful. It's very damaging. And so that kind of trauma really needs, for example, if it is experienced as trauma, because only you can tell, then it needs, to be worked on. But to add to that, if you are being told at a young age, well, there's nothing wrong with you, whereas there is something wrong with you, but it's all being denied, you will internalize that in a negative way. And you will start to see it as, well, it's got to be me. So I am now going to deny any physical symptoms I'm getting. I'm going to push through. And this is when you get into the boom bust and, the self-blame and the anger and all those really difficult emotions.
Yeah. No, that's very helpful. One thing that's interesting, and I wonder if in the light of that, it's just a springboard, one of the things that's come up on the Q&A is a little bit about dealing with this sort of anxiety of knowing you're not well and living with the fear of the next episode. And have you any recommendations for managing anxiety? People say that they experience that, as part of their lived experience with living with constant pain.
We will be, there is a question later that deals with this, and I am going to talk a little bit about anxiety, so we will get to that.
Okay, sure. Good. No, that's good. Now, can CBT help people who are physically well? This is like the opposite way, people who are feeling better, but maybe have an imposter syndrome, or they're feeling physically well, or is there a better therapy for those who aren't physically well? You know, like, does CBT only address those people who are not physically well, or does CBT work for people who are physically well and maybe they're just addressing some mental issues?
I think it doesn't matter whether you're physically well or unwell. CBT will address the thoughts or beliefs you have around not being well or physically well. So whether you are well or not well, actually, it doesn't matter, because the CBT will modify itself. It will adapt itself to your circumstances. Yeah, so as I explained, it really looks at your particular thought patterns, your particular behavioral responses to, for example, not being well, and what can be done around that, and what kind of beliefs do you have about that, and what kind of meaning do you give this. And then it goes deeper and looks at, you know, what kind of core beliefs, and that means the really deep-seated beliefs we have about ourselves. You know, the beliefs that are a bit like, I am, you know, I am bad, I'm not enough, you know, I'm not worthy. So it doesn't actually matter whether you're well or not well.
Right.
I hope I'm explaining
Yeah,
that.
no, that's helpful. It's helpful. Yeah, no, that's good. Okay. How can you secure or be signposted to a mental health specialist at diagnosis? How can you go about that?
Yeah. So usually when you get diagnosed, it's by an endometriosis specialist or a specialist team. And so you should, at that time, definitely mention that you want access to psychological support. So again, there's a bit of assertiveness necessary here. So either the hospital itself will have a pelvic pain service or a clinical health psychology department that could support you. And if none of this is available, you can ask them about what else they can provide for you. But if all of that fails, you will need to go possibly private and see if you can find a psychologist that works in a holistic way by looking at both the body and mind and how they interact with each other, because that's typically how a clinical health psychologist works. However, many mental health professionals can help in at least helping you to work through difficult emotions and explore all the different ways endometriosis is affecting you. So you don't necessarily have to see a specialist. It just helps if the person knows a little bit more about the condition and how it affects you. But you can also educate them. You know, as I said earlier, psychological therapy is by definition an unconditional, positive regard, helpful, safe place. You know, you're not being judged. You can talk about anything you like. You can use that space to talk about it. So just to reiterate that, because you know, I guess it can feel like, well, she's talking about specialist services and all that. There's none of that where I am. It doesn't necessarily have to be a specialist service. That's all I'm trying to say.
Yeah, that's okay. That's helpful. Yeah, no, that's good. That's good. Have you got experience with supporting those who are balancing education, social life, and endometriosis flare-ups? If so, were you able to offer mental health support? How were you able to? When people are juggling lots of things and they're wanting mental health support, how do we fit all of that in? So anything you can mention to that?
I had to chuckle a little when I saw that question, because I have worked with some ladies who are exactly like that. And I have to say, it usually gets their schedule, their busy schedule gets in the way of having weekly psychological therapy sessions. Because typically when I start working with women, I'd like to see them weekly, especially if we do trauma work, because that often is distressing and it needs to be addressed on a weekly basis, you know, until things have resolved and they're starting to feel a bit better. So many of the women who I've worked with work themselves 9 to 5, which is the same hours I do. So it's really difficult to schedule regular sessions in. So all I can say here is that if you're one of these women who are working and looking after the family and the household and everything else, please stop some of that. It's really important to try and make your health and well-being your number one priority. So this means very often working less or delegating some of the things you do to others in your life. And I know that working less can be really difficult for financial reasons, but your body will thank you for it, because it will not get time to heal, to rest, to recuperate. And that's what's necessary. So many women I've worked with are working too hard, pushing themselves so hard that fatigue and severe pain follows. So, you know, it's just a, what you call that, like burning the candle on both sides almost. So finding that right balance for yourself is so important. So creating moments of self-care, you know, by, I don't know, having a bath or working part-time, you know, all these things will help you. So yes, in short, I have worked with women like, like that.
Yes, that's well, it's good to know. And I think too, you know, people are very different, and sometimes the escapism of being busy helps you not address things, and sometimes there's a season for addressing things and there's a season for not addressing it. And we're all at different places on that journey, that, you know, and sometimes it's not you that you have to address. Sometimes you go for help to help you cope with addressing other people and their response, or lack of support, or lack of understanding, or your tiredness with understanding what they, you know, what they don't get. And then that has a knock-on effect, because you think, what is wrong with me? Why are they not getting it? So it, you know, that there are sometimes, you know, personal support mechanisms that are needed in a period of your life that maybe you maybe don't feel so confident.
Yeah, I think a little bit of selfishness is good here.
Yeah, it's not always a bad
Because
thing.
that's the problem. So often it's because we're women, you know, and so typically women take care of others and the house, the children and everything else. And yeah, being a bit more selfish would really help here. And also remember that being like not doing for a bit will help you to do more later. Because I think we live in a society where we're so valued on what we do, you know, what we achieve, the targets we achieve, the money we make, the status we have. And it's just not helpful. It's so good to create space for being, just being still. And, you know, maybe do some meditation or do a walk, mindful walking, or do something that provides stillness and relaxation, because that is so important. So yeah, I think that whole thing about what you've just said as well, about people not understanding, again, communication comes into that. Very clear communication, because the problem is that I think what happens if that others don't understand, you then start blaming yourself once again, because if I can't change them, then I'll just have to start changing myself in order to be able to live with myself. So you start further denying your own needs and blaming yourself and criticizing yourself. And so it's so unhelpful. So it's really, really important to be clear about what you can and can't do.
Yeah, that's really good. And it sets boundaries for yourself and for other people as well, to know how best to help you and how best for you to help them at the same time. Yeah, that's a very good point. Okay, here's another question for you. These are just great questions, guys, and the questions in the Q&A are fantastic, and I'm frustrated I can't answer them all at once, but we will get to them, so be reassured of that. I think so. Let's have a look at this one. How do you reduce self-blame during a flare-up? For example, thinking a flare-up was a direct result from what you ate, drank, didn't do are there any techniques about self-blame that you would bring into the discussion?
Yeah. Well, as I've explained, this self-blame starts at a very early age. Like I keep bringing up the, you know, the experience as a young girl at the GP, which is so informative. This self-blame often lies in those early experiences. So self-blame is very often a feature in endometriosis. I think I've already spoken about when you see other girls around you. Sorry, I'm just also looking at my own notes. Yeah, so I'm just looking at my notes where I'm explaining how going to the GP, then being told nothing wrong, then seeing girls around you, you know, I'm just going through that here. But coming back to your question, techniques to help you with self-blame is to be, first of all, kind to yourself and acknowledge that the scenario that I've painted with going to the GP and then being told nothing is wrong, and then, you know, seeing girls not having to take time off, etc. In that scenario, you know, please remember that this is not something you chose. So that's, first of all, really important to remember. So be kind to yourself, be compassionate to yourself. So when you start having, you know, self-blame come up, there are, so for example, you can do breathing exercises to relax, to distract from what you're thinking, because self-blame, of course, again, is driven by thoughts. You can do mindfulness meditation, which also helps you to focus on the body and the breath instead of hooking into your thoughts, because our thoughts are not us, actually. It is, you know, they're just manifestations of the mind. They're just chatter that the mind likes to give us, constant white noise. So try not to hook in them. Try to focus on the body and the breath, and that's what mindfulness and meditation is about. And you can also do gentle exercise, such as gentle restorative yoga, as these will all help you. So self-compassion is actually really important in the context of self-blame. It is not your fault you have flare-ups, as these are typically caused by your periods due to a rise in estrogen. So, and I think, and again, I don't know who's asked this question, but in my experience, flare-ups happen when you have your period. There may be other causes, but I'm just going to focus on that. So tell yourself, first of all, that it's not your fault. Secondly, tell yourself you're doing the best you can. There is absolutely no value in beating yourself up, as it will raise your pain levels. A lot of research has shown that pain will be negatively impacted by stress, negative thoughts, and emotions. So actually getting yourself into that cycle of self-criticizing, self-blaming is actually going to raise your pain levels. So totally unhelpful. So if you have been affected by flare-ups, you will also expect these to be accompanied by pain and other negative associations and beliefs. And these will all have an impact on your pain. So, and as I said earlier, if you've experienced trauma in your past, this will also make you more sensitive to pain and heighten the experience of pain. Because trauma tends to sit in the body, and if it is unresolved, can cause an inflammatory response, as I said earlier. So that's really, there aren't particular, I mean, CBT, for example, could help you with self-blame because it is a thought process. So remember, CBT you could focus on that if you were to get some CBT therapy, if that is your particular issue. But I hope that I'm trying to explain here the few things that you can do to help take the focus off what you're thinking and restore some calm in your body, because you know, all these negative symptoms, such as emotions, thoughts, etc., associations that you have with pain, can increase the severity of pain. So just remember that. It's really important.
No, that's good. Thank you. That's helpful. Yeah. We're racing on now. We're into the last question or so. Is there a long-term effect on mental health from ingesting lots of painkillers to overcome your body, pain caused by the endometriosis? So there's a question about the painkillers, but there's also a question about the effects hormone therapy has on your mood. Could you combine those together and address those together? It's about the ingestion of tablets and the effect that that has, and that's a bit of a theme on some of the Q&A as well, about recommendations for tablets to take and the effects that they have on our mood, particularly because a lot of the treatments are hormone based. We know that that has an effect on our emotional well-being too. So I wonder if you can condense that one, and then we're cruising into crushing in as much as we can in the last 3 minutes.
I will try. So first of all, this is of course different for each person. Again, I need to underline that. So what's it? Yeah, so I think if you are willing to engage fully in psychological therapy by addressing and exploring everything that is upsetting you, you can greatly benefit from it. So many women tell me that they find initial relief in talking about their experiences, and to someone who's validating their experience. And it very much depends on your own individual background and experiences you've been through. So I'm really talking about the long-term effect on mental health here. I think it is really useful to keep in mind that it took, let's say you're 35 years old, it took 35 years to get to the point in life where you are now, and at which point you want to seek psychological support. And so it may take you a few years to unpack all of what's happened to you in order to feel better. So usually if you feel better psychologically, you will feel better physically, because they do go hand in hand. There's a huge overlap, and one has an impact on the other. So that's really important to remember. So in terms of the hormonal treatments, I know they affect people badly. I've had one lady tell me that for 3 weeks she's on it, then she's off it for 1 week, and in that 1 week she feels very depressed, and every time she knew that time was coming, she was feeling anxious about it, worried about it, a bit hopeless about it. And we just try to reframe what was happening, and we just try to see it as, okay, it's happening, but you also know there will be an end to it, because at the end of that week, when she takes the first tablet again, she almost immediately feels better. So it's a way of changing the way you look at things that really helps. But I want to say here that it's really important to keep discussing with your consultant the ways the hormone treatments are affecting you, because there are developments all the time within this field, and there may be a different treatment you can take that will help you. And you can ask, for example, for review appointments in order to change those treatments if necessary. But I think that overall, the same strategies would work on emotions caused by hormone treatments as on emotions caused by other reasons. They're still emotions. I think, again, I need to say here that you need to be kind to yourself by recognizing that it is the hormone treatment that's causing this and not you. Also, you can keep a diary and write down everything you are experiencing and keep track of what's causing on different days, what's happening on different days. So you can start perhaps looking at, okay, I know that day is coming. That was the same day, the last month. If I do this, maybe it will help me. So it's a little bit of problem solving for yourself, a bit of figuring out how is it affecting me at different times of the month. And you can do this with your therapist as well, of course. So anxiety, because I think there was something about anxiety and rage. So anxiety can be greatly helped by breathing exercises, relaxation techniques, CBT techniques, and CBT in general, and exploring, because just like with anger, what may be underlying the anxiety could be more deep-seated emotions, because anxiety can also be a masking emotion that often comes to the surface when we're not acknowledging a deeper seated emotion. So it's the body's way to say something isn't right. So preventing these emotions may be difficult because the hormones may be causing them. But I would say if you do suffer of anxiety, then, and it is debilitating for you, then for sure try some CBT, because that will definitely help you, because it's, it's a thought maintained disorder. But you may also want to go deeper than that and look at what is going on in your life. What is it that I'm masking? What is it that I don't want to acknowledge about myself or about my situation? So yeah, it would be really helpful to explore that in therapy if you can, if you are accessing any therapy.
That's great. No, thank you. I'm sorry to be so brief now, but we are getting to the end of our time, which is really frustrating because I'm just wanting to kind of collect some of the other questions.
It's okay. I can still.
There are one or two other little ones that I think would be wrong to ignore.
Sure.
There's a question around fertility that I think, given that you work in the area that you do, some people have a question about the fertility, the effect on fertility treatment and their mood and how they are. And basically, do you think pregnancy affects mental health for better or for worse? There's this kind of question of the whole hormonal response. I suppose we've talked a little bit about that, with whether people are feeling better or worse and how they address that, and things. But then also there's another set of questions really that I want to do with the impact of endometriosis on how you are, like physically. You maybe put on a lot of weight because of the treatments that you're taking, and the knock-on effect is your self-esteem is low and you feel bad about yourself because your weight isn't what it was, and maybe you see physical changes that you don't like. Any tips on that one as well? So, these things are, they're great questions that people are bringing to the table, and I feel bad that it's not a quick 2-minute answer to any of these. So I do wonder whether some of these questions are actually opening us up to having another webinar with further questions, at a little bit further on in the year, because they're not quick wins. But I would be grateful for the fact that you've raised them with us, because it really gives us the pulse of where it's at for people. And I know too, we haven't really addressed acupuncture, physiotherapy, alternatives that people are asking about. Are they available? Do they help with the benefit?
Well,
kind of thing. So
I can say a little bit about the alternative therapies. There's definitely a type of massage called myofascial massage that can really, really help with scar tissue, for example. So you could check that out, because that can really help with pain. I would say that maybe a physiotherapist might know this technique, but they probably need to work in women's health in order to get that kind of massage. And cranial osteopathy is also really helpful, because when we're operated on, the energy channels within our bodies is blocked. It gets severed, and then it can cause, what you call that, an imbalance in the body. So cranial osteopathy is also immensely helpful, also in terms of dealing with some trauma in your life, balancing out, just your body as a whole. It's a wonderful treatment to undergo. It's very relaxing as well. So I can really recommend that. But in terms of the questions of self-esteem and, your body changing, and perhaps body image issues as a result of maybe the treatments you're taking, or perhaps a lack of exercise that you would like to do, all these issues can easily be explored in just general therapy. If these are issues that you think, you want to have help with, just talk about it. If you are accessing any mental health service, talk about this stuff. You know, it will really help you, because it's very difficult for me to go into the specifics without knowing the specifics, if you know what I mean. So I hope that helps a little bit, because of course it's difficult for me to give more information if I don't know more about the person's, you know, circumstances.
Yeah, I appreciate that. Yeah, no. There are lots of questions still, and there are some issues that obviously are still ongoing. We will have to finish because our time will run short. There are a couple of responses I'll try and respond to on the question and answer before I shut it down altogether. But just to say thank you very much for your engagement, Margreet, and also for all of you out there who've been with us this evening. The webinar will be on our website, our endometriosis website, and there may be specific questions that you have. It's difficult when we have anonymous questions because you can't always know if you're responding to the right person at the right time, and with the different bits of communication that come our way. So apologies if we haven't addressed everything that everyone's asking, but we will endeavour to do that. And as we go off, we do take record of the questions and seek to reply where we can, and add that to the webinar. So just be assured of that. Nothing is irrelevant, nothing's not useful, and things. And you can always get in touch with us at Endometriosis UK, or you'll know our details if you've registered already on the webinar. But Endometriosis UK have a support team, and we'd be very keen to help and direct and point you in the direction of support if that's possible. So please don't leave it there, you know, in any way. That would be wrong of us to not reply, and wrong of you to not respond to us too. So thank you for your time. Thank you for your evening, Margreet. We appreciate that, and we look forward to future communications and webinars together. So thank you very much, one and all.
Oh, well, it's been really a pleasure. And I just want to say here, I'm sorry if I haven't addressed very particular issues, because I'm actually just looking at some of the questions myself. Some of them are very valid, but they're very complex questions for me to just answer here. I hope that, you know, giving a general idea has been helpful.